I just want to mention this prior before I get the video started. My patient is a teddy bear, so I'm going to be using my skin injection pad down here because I can't get it wrapped around the teddy bear, but I will identify the locations and the areas where the injection should be at. Hello, how are you today? Good. My name is Hannah. I'm going to be your nurse. Can you verify your name and date of birth for me, please? Okay, let me verify your allergies. So you're allergic to bee stings. That's no problem today. I'm just going to verify the orders that you have for your injections. I've got your COVID vaccine, I've got your TB test, and I've also got your insulin. Okay, so I'm going to be giving an IM injection. You're supposed to use, if it's indicated, you use the Z-Track method, but I'm not going to be using that because it was not indicated. Now, for the intramuscular, it can be given on your thigh or it can be given on your arm. I'm going to be using your arm today, okay? Is that okay with you? Okay, now this is your COVID vaccine shot, okay? Okay, I'm going to be giving this to you by the right drug, right dose, right route, right time, right documentation, and right patient. I've already verified you, and I've already verified the order for all 3 injections, okay? Prior to this video, these were all filled. I'm going to maintain a sterile technique, perform hand hygiene. I'm going to cleanse the surface. With my non-dominant hand, I'm going to take and find the muscle in the upper arm. Maintaining my sterile technique. With intramuscular, you're supposed to give it at a 90-degree angle, so that's exactly what I'm going to do with the bevel up, okay? 1, 2, 3. You're supposed to pull back on the syringe, and if there's any blood that comes in it, you stop giving the injection, but I don't see any blood. So I'm going to go ahead, stabilize the syringe, go in at a slow and steady pace, and then I'm going to take it out. I would dispose of that in the waste box or waste basket, but I'm just going to cap it for right now. Keep applying pressure and then put a Band-Aid. Okay, I'm going to effective for drug response and effectiveness, okay? Okay, document right after you do this. For the next one, I'm going to be giving you your insulin shot, which is your subcutaneous, and I'm going to be giving that on your abdomen 2 inches below or at your umbilicus, and then you could also give it in your thigh, okay? But I'm going to be giving it on your abdomen. Is that okay? Okay, I'm going to prep the site, maintain a sterile technique, cleanse, and then for insulin, if they are obese, you give it at a 90-degree angle, and if they're not obese, you give it at a 45. So I'm going to be doing a 45 today. So I'm going to pinch, put in at a 45, slow and steady, let go, and put the medicine in, and then I'm going to take it out. I'm going to dispose of this. I would keep applying pressure and then put a Band-Aid on when I'm finished. I'm going to monitor for drug response and effectiveness. Does that feel okay? Okay. For the next one, I'm going to be giving you your TB test. Now, I can do that on your inner forearm or on your scapular for allergy testing, but today we're going to be doing it on your inner forearm, okay? Okay. I'm going to still be maintaining my sterile technique. I have verified all the orders 3 times, checked for the right drug, dose, medication, route, patient, documentation, right time. This was filled already, so I'm giving your TB. I have cleansed the area. I have maintained a sterile field. I have gloves on. I'm going to find the spot, bevel up at a 15-degree angle. Stabilize the syringe, 15 degrees, slow and steady but effective. Pull out easily, apply pressure, clean, and put a dressing or gauze on it. And with TB, you would expect to see a little bump on the skin, and then you would have to monitor it and record it. I'm going to record, report, and document. I verified all of your orders. I cleansed, maintained a sterile field. If Z-Track method was indicated, I would have done that for intramuscular, but it wasn't indicated. I've located all the areas, or almost all of the areas that you could use to give these injections. Your vital signs would have been checked beforehand. I verified the orders, I documented, I checked for allergies, so I think we're good, okay? Okay, thank you. Now I'm going to evaluate for effectiveness and drug response. and then I'm going to document and upload on the MAR.